Okay, good afternoon, everyone. Today we will still meet. The topic is about new drug development for Alzheimer's disease. So let me share my screen and let's start the topic today. Okay. Okay. Today we are going to talk about Alzheimer's. And this is the outlines for today's class. First, I would like to talk about what is Alzheimer's disease. And then I will going to talk about a little bit pathology of this Alzheimer's disease. And next, introduce the drugs for the treatment of Alzheimer's disease. Okay, first, introduction for Alzheimer's disease. So what's Alzheimer's disease? As you can see, Alzheimer's is a degenerative brain disease that is caused by complex brain changes following cell damage. It leads to dementia symptoms that gradually worsen over time. So as you can see in this photo, nowadays, the Alzheimer's disease has become a desired global health concern among the elderly people. As you know, because the hospital is working well in many of the developed countries, so the people can live a longer life. However, as they increase their years they live, it brings more highly that they may develop dementia or Alzheimer's disease in the later years. And account to current statistics in 2019, nearly 50 million people suffering from Alzheimer's disease or Alzheimer's disease-related dementia worldwide. And in China, according to the statistics in China, now China has at least 10 million patients with diagnosis Alzheimer's disease, so affecting almost 1/3 of their population age 19 to 94 years old in China. So the drug market for this Alzheimer's disease is very big, not only in China, but also in the whole world. So here we can see one concept: Alzheimer's leads to dementia. Then someone may confuse about the dementia and Alzheimer's. Are they the same disease? Not really. It's a little bit different. I will introduce the differences between dementia and Alzheimer's in the later slide. And here shows one photo. I'm sorry, it's in Chinese because I cannot find the same photo in English. Here is talking about the Alzheimer's Day for international, for the whole world. It's September 21. That's because more and more patients suffering for Alzheimer's disease. So their international set up a special day to make sure everyone know about this disease, pay more attention to the drug development for this disease. So because the market is super big and a lot of old people suffering from this disease. So the society wants everyone to pay attention for the treatment of Alzheimer's. So September 21 has been set up for the Alzheimer's Day. And here, a little bit introduction about Alzheimer's. So Alzheimer's is a progressive disease, beginning with mild memory loss. So at the very beginning, you may do not remember something and possibly leading to loss of ability to carry on a conversation and response to the environment, which means that maybe when you're doing a conversation with someone else, if you're suffering Alzheimer's, you may forgot the last sentence you mentioned and do not know how to respond to others. So this is the symptom for Alzheimer's. So at the very beginning, a little bit mild memory loss, and possibly the memory loss leads to loss of ability for response correctly to the environment. And then as Alzheimer's advances, symptoms get more severe, including disorientation, confusion, and behavior change. So eventually, speaking, swallowing, and walking become very difficult for those patients. So Alzheimer is not a normal part of aging, but the greatest no risk factor is increasing age. What does that mean? That means that maybe increasing the age may increase the risk to develop Alzheimer's, but not every elderly people will develop this Alzheimer's disease. So Alzheimer's is not a normal part of aging. Not everyone will have that, but when you live longer, you will increase the risk to develop this Alzheimer's disease. So you need to understand that. Increasing age is only the risk factor for Alzheimer's. And here, it's talking about the differences between dementia and Alzheimer's disease. So that's two different concepts I would like you to understand better. First, dementia describes a group of symptoms associated with a decline in memory, reasoning, and other thinking skills. So based on the concept, it's a little bit similar to Alzheimer's. However, for dementia, many different types of dementia exist, and many conditions cause it. And Alzheimer is only the most common cause of dementia. Usually, it accounts for 60 to 80% of dementia cases. So, in other words, Alzheimer is a specific disease, but dementia is not. Dementia includes Alzheimer's disease and other types of dementias, and Alzheimer's is only one specific disease which causing dementia. And as we mentioned here, Alzheimer's is the most common cause of dementia. More than half of the dementia are caused by Alzheimer's. So that's the differences between dementia and Alzheimer's disease. That's two different types of disease. So you need to understand better. And here, I would like to introduce a little more about dementia. So dementia is not similar to Alzheimer's. Dementia is not a normal part of aging as well. It is caused by damage to brain cells that affects their ability to communicate, which can affect thinking, behavior, and feelings. Some risk factors for dementia, including age and genetics. So maybe there are concepts between dementia and Alzheimer's is similar, but they are completely two different types of disease. But the risk factors similar within dementia and Alzheimer's. That's because Alzheimer's is one of the main reason to cause dementia. Maybe that's the relationship between them, similar to each other, but not the same. Okay, here shows more dementia types. As you can see in this page, dementias can include a lot of types. The first one is the Creutzfeldt-Jakob disease, which can cause dementia, increase their cognitive problem in their patient. And then the second one is Lewy body dementia, which if you do the section for the brain, you can find this Lewy body here. And the next is the Down syndrome. This is a very common disease happened in the babies. The Down syndrome, as they grow up, they will have something dysfunction in their neural system to increase dementia. And next is the Alzheimer's disease. So as here show that Alzheimer's disease is actually one type of dementia, which is also the major type of the major reason to cause dementia. And then the next is the frontotemporal dementia. And next is the Huntington's disease, and also some dementia developed for a very complicated reason. So those time maybe mix different genetic diseases and other environmental factors, and those dementia we called mixed dementia. And also here shows more types of dementia, including the normal pressure hydrocephalus and posterior cortical atrophy. And another very famous disease called dementia, the Parkinson's disease dementia. And also next is the vascular dementia. I think it's not that familiar to most of the students why vascular problem can cause dementia. That's because here this photo shows the structure or the photo of the brain, right? As you can see, the brain is the most important organs for human being. It controls every living functions inside our body, right? So the brain needs the nutrition from the vessels supply the oxygen, the nutrition which are delivered by vessels in the brain. So once the vessels block or have dysfunction, block the delivery of the oxygen and nutrition to the brain, and that will cause severe brain dysfunction, which is called vascular dementia. So this is also a very very common type of dementia in clinic. And the last is the Korsakoff syndrome. So all these dementia types, some are caused by genetic mutation, family history, aberrant genes, and some of them may caused by other factors. So this is all types of dementia. As we mentioned, Alzheimer's only is the major cause of dementia. So once again, if we talk about dementia and Alzheimer's disease, there are two different concepts. I hope you can remember this by your heart. Okay. Then next, let's introduce a little bit more about the causes and risk factor for Alzheimer's disease. So for the research data, most of the researchers believe that Alzheimer's is not caused by a single factor. It likely develops from multiple factors. So it's a very complicated disease. Maybe a lot of factors work together to develop this Alzheimer's disease. So here just list some of the risk factors and causes. Actually, the mechanism for how Alzheimer's disease is developed is still unknown. So the scientists still working on the pathology or the pathological mechanism for this disease. So they hope that once they make clearly mechanism understanding, maybe they can cure this disease in the future, but not now. They are still working on it. So here shows the causes and major risk factors for Alzheimer's. The first one is about age. As we mentioned, this is the major risk factors for the development of Alzheimer's disease. This is the greatest known risk factor for Alzheimer's and other dementia. So increasing age will increase the risk to develop Alzheimer's and other dementia types. But these disorders are not a normal part of aging. So that means not everyone getting old and then they get Alzheimer's or dementia. Only increasing age is only the major risk factor, but not the key factor to develop Alzheimer's disease. So while age increases risk, it is not a direct cause of Alzheimer's. Someone may live very healthy and do not develop any mental diseases, and they can live very clear elderly life. So this is only the risk factor, not the direct cause of the Alzheimer's. So most individuals with the disease, with the Alzheimer's disease, are around 65 years old or older. Then after 65, the risk for Alzheimer's will double every 5 years. So 5 years later, the risk for development of the Alzheimer's disease may double. And after age 85, the risk reach nearly 1/3, increase 1/3 every year. So increasing age is one of the major risk factors for Alzheimer's disease, but not the direct cause of this disease. And then next are another causes or risk factors is the family history. This is another strong risk factor, also not the direct cause, it's just the risk factor, is family history. So those who have a parent or brother or sister with Alzheimer's are more likely to develop the disease. It's more like genetic related to develop this Alzheimer's disease. So the risk increases if more than one family member has the illness. So when you check back the family history, you may have a prognosis to tell if this person is likely or not unlikely to develop this kind of disease. Then the next causes and risk factor is the genetics. So there are two types of genes influence whether a person develops a disease. One is the risk genes. So risk genes means that if you have that gene, it's more likely they have a higher percentage to produce this disease. So that's a risk genes. Another one is the deterministic genes. So deterministic genes means genes that cause a disease rather than increase the risk of developing a disease, which means that once you have this deterministic genes, then you have almost 100% to develop this disease, but sometimes it's not that completely. It's just a higher percent, maybe more than 90%, around 90 to 100% to develop this disease. So Alzheimer's gene has been found in both risk genes and deterministic genes. The two types include the Alzheimer's genes. So it is estimated that less than 1% of the Alzheimer's cases are caused by this deterministic genes. So which means that this deterministic genes is not that common, it's very rare, only related to 1% of the Alzheimer's disease. Okay, let's see the details more. So look into the details about the risk genes. The risk genes increase the possibility of developing a disease, but do not guarantee it will happen. One of the first found risk gene is the ApoE4. It is the first risk gene identified and still now remains the gene with strongest impact on risk. So based on the researchers' study, they've estimate that between 40 to 65% of people who diagnosed with the Alzheimer's have the ApoE4 gene, which means that if the patient have the ApoE4 genes, they will have a higher percentage to develop this Alzheimer's disease. So this is the risk gene. That's based on their study. They collect their Alzheimer's patients and then screen for this ApoE4 gene. They find that around half, 40 to 65% of the patient have this ApoE4 gene. So they think this is a strong related risk gene for Alzheimer's disease. So nowadays, some of their studies focus on this ApoE4. For example, they can design the genetic kits for screening. So once the woman get pregnant, they can screen for those genes, and then they may have a better idea if they have their Alzheimer's family history. They know more about this if they have these risk genes in their babies. Okay. Next is the deterministic genes. So deterministic genes directly cause a disease, guaranteeing that anyone who inherits one will develop a disorder. So that's different from the risk gene. The risk gene means if you have this gene, you may develop this disease. But the deterministic genes means almost 100% you will have this disease because you have this deterministic genes. So these genes are estimated to account for only 1% or even less Alzheimer's disease. So they are very rare, not very common in the big population. Only small part of the population have this deterministic genes. So all of these deterministic genes affect processing or production of beta amyloid. So this beta amyloid, later I will introduce more details about it. This beta amyloid are the protein related to the pathology of Alzheimer's disease. So in the brain, you see this beta amyloid oligomers and then form the plaques, and so that exhibit the toxicity to the neuron in the brain. So this is a very key component to induce Alzheimer's disease. So once they have the genes with this aberrant processing of this beta amyloid, they will have very high risk to develop the Alzheimer's disease. So beta amyloid is a plain suspect in the decline and death of brain cells. So it's very important component to in the pathology of the Alzheimer's disease. So those genes reflecting to this beta amyloid are called deterministic genes. So this slide shows to the right, there's a photo, shows 23 chromosomes pairs for human being, right? So inside them, 4 Alzheimer's genes are identified. The first one is very important, which is called APP. The full name for APP is amyloid precursor protein. So based on this name, you know what is APP. So APP is the beta amyloid protein precursor. So once this APP gets dysfunction, they will have a higher chance to develop the dysfunction for beta amyloid, so that to promote the Alzheimer's development. So this one is kind of called the deterministic genes, APP. And next is the PX1. The PX1, the full name is presenilin 1 and presenilin 2. These two genes, PS1 and PS2, also related for the APP processing. So the first 3 genes you can call highly related to the development of Alzheimer's. And the last one, the ApoE4, is the risk genes for the development of Alzheimer's. So far, these 4 genes have been well studied to understand the Alzheimer's disease development. So these 4 genes is well studied in a lot of labs, and even the companies design their screening kits for their basic screening for most of the patients if they want to know if they have this Alzheimer's disease genes. So this is 4 identified Alzheimer's genes. Okay. And next risk factor is the head injury. So based on the clinical study, the doctors find that there is a link between head injury and future risks of dementia. So to avoid this head trauma injury, we can have a lot of intervention to prevent the head injury. For example, we can protect our brain by buckling the seatbelts when you are driving, and you can wear the helmet when participating in sports. So all these very simple steps can protect head injury so that to reduce the future risks of dementia or Alzheimer's disease. So this is another risk factor, head injury. And next is the heart-head connection. So some of the strongest evidence links brain health to heart health. So maybe some of the students cannot understand why the heart is related to the head. However, as I mentioned in the vascular dementia, because our brain have a lot of blood vessels, they need nutrients by our heart. So the heart pumps the blood throughout our body so that they can deliver the oxygen, the nutrition to the brain to maintain the normal function of the brain. So if the patient have a poor condition, heart condition, that may have a higher chance for them to develop brain problems, the brain injuries. The risk of developing Alzheimer's or vascular dementia appears to be increased by many conditions that damage the heart and blood vessels. Those risk factors including their heart disease, their diabetes, because the diabetes, they have a high level of glucose inside the blood so that they can increase the chronic inflammation. Those chronic inflammation can damage our heart, and so that to develop the diabetic myopathy, right? And also, if the patient have the condition of stroke, some of the vessels in the brain are blocked, also affects the function of the brain to develop higher chance to develop this Alzheimer's disease. And also the high blood pressure, which is a risk factor for the heart and also the vessel, and high cholesterol. So all these factors which harm the heart or blood vessel may also increase the risk for development of Alzheimer's disease. So this is called heart-head connection. Okay. And next would be overall healthy aging. So what's overall healthy aging? So one promising line of research suggests that strategies for overall healthy aging may help keep the brain healthy and make even reduce risks of development Alzheimer's and other dementias. That means everyone should have very healthy lifestyles. For example, they eat healthy food, more vegetable, fruit, but less red meat, and staying socially active. Try to communicate with others oftenly, and also avoiding tobacco and excess alcohol. Those are well-known risk factors for both the brain and the heart, right? So avoiding tobacco and excess alcohol, and also exercising both the body and your mind. So I think exercise the body, everybody would understand that because sports do good to our health, right? But don't forget, besides the body, you need to exercise your mind. For example, when get older, still keep in touch with their whole society, try to connect on internet to learn new information, try to read newspapers, stay in line with the young people. So those can help to exercise your mind or your brain. And one study have showed their research about the Alzheimer's or dementia related to brain exercise. They found that learning a second language can help to prevent Alzheimer's disease and dementia. So try to find something new to learn, especially with specific skills that can help to exercise your mind to prevent those mental diseases. So that may be a good idea to learn a second language. And also you can try to learn piano or violin or something else. Just keep your brain or your mind busy with something new, then can protect the dementia or Alzheimer's disease. Next, I would like to talk about 10 early signs and symptoms of Alzheimer's. I think that's very important for the diagnosis of the patients, because when someone getting old, it's common to find that memory loss and challenge in planning things and solving problems. That's a very typical age-related change, right? So someone think maybe I'm not getting the Alzheimer's, I'm just getting old. So how to tell the differences between the Alzheimer's disease and the typical related change because of the age, that needs the experts all doctors to tell. But here, just know that some of the early signs may give you a hint that someone may develop this Alzheimer's disease. So the first change would be the memory loss, which disrupts your daily life. But how to tell between the typical age-related change? That if someone get old and have the survived experience about the memory loss, that happened only sometimes. Some old people may forget some of the names and appointments occasionally, but not every day. But sometimes they can remember them later. That kind of change is typical age-related change. However, for Alzheimer's disease patients, that memory loss will continue for long term, and this memory loss will significantly affect their daily life. So this is the first sign or symptoms for Alzheimer's. And the second one will be challenges in planning or solving problems. They don't know how to do their daily schedule anymore. They don't know how to pay the bills to solve any problems and so on. Those are second signs for the Alzheimer's. And for the typical age-related change, only making occasionally errors when managing financials or household bills. So that depends on how often it happens. Very often, that maybe have a higher chance to develop the Alzheimer's disease. If only a few times for example, in 2 months, that may be getting old and forget things normally. And next is the difficulty completing familiar tasks. So this one, I think it's easy to understand. For example, I drive to work every day. So I remember how to get from home to my office every day because I drive every day. So I remember how to get there very well. But if I developed Alzheimer's disease and that I find after 10 years, I forgot the way to go to office, which I went every day in the past 10 years, that may be a sign for I have disease such as Alzheimer's disease. For a typical age-related change would be occasionally needing help to use microwave settings or to record a TV show. That's still how often it happened will tell the differences for getting old, the age-related change or the Alzheimer's. And next, confusion with time and place. And sometimes for those Alzheimer's patients, they don't know what day is today and where I am, what I'm going to go. So those confusion may disrupt their normal daily life. And for typical age-related change, only getting confused about the day of the week, but they can figuring it out later. So that's the differences between disease and age-related change. And next is the trouble understanding visual images and spatial relationships. For example, what does that mean? They may have, for the Alzheimer's patients, they may have problems judging distance and determine color or contrast. So those problems may cause issues with drawing. That's Alzheimer's disease. They have some trouble understanding visual images. They cannot judge how is the difference between their own car and others' car, that they may cause car accident. So the Alzheimer's disease patient cannot drive by themselves. And then for this trouble understanding visual images and spatial relationships, if it is related to the typical age-related change, only is that the vision problem may caused by the eye disease, for example, the cataracts, which is caused blurry sightseeing for the old people. That's not caused by the dysfunction of the brain, but just the dysfunction of your eyes. So this one is different from the Alzheimer's symptom, trouble understanding visual images and spatial relationships. And next sign is the new problems with words in speaking or writing. Then, as I mentioned before, one of the symptoms for Alzheimer's, they cannot follow up the communication or conversation with others. Maybe they forgot what others have said just in a few seconds ago, and they don't remember what's the topic about their conversation. So those have problems with words in speaking and writing are symptoms of Alzheimer's. But for typical age-related change, only sometimes the old people have trouble finding the right word. So that's different. And next sign will be misplacing things and losing their ability to retrace steps. They don't remember where they put the things. They don't remember what they have done to those things. They have trouble retracing the steps they have done before. And for a typical age-related change, misplacing things from time to time. However, they can retrace steps back to find them. So that's the difference. And next will be decrease or poor judgment. They may use poor judgment when dealing with money. For example, they will pay more or pay less for the bills, and they pay less attention to grooming or keeping themselves clean. So those the decrease or poor judgment. And for typical age-related change, making a bad decision or make mistakes once in a while, like forget to pay their bills, forget to change their oil in the car. That's just age-related change. But for the Alzheimer's disease, they will have poor judgment and pay less attention to themselves. And the last two symptoms, the last one is withdraw from work or social activities. So because they cannot follow others' conversation, right, for the Alzheimer's disease patients, so they are afraid of contact with others. So they will withdraw from their social activity or from work. So this withdrawal from work or social activities will in further leading to worsen the disease development because they cannot maintain the social activities and cannot exercise their mind anymore. So they will make their disease worse. And for a typical age-related change, just sometimes feeling uninterested in family or social obligations, that's different. And the last one would be change in mood and personality. So for the patients suffering from Alzheimer's, for example, 20 to 30% of the early Alzheimer patients show significant depressive symptoms and mood change. So maybe before he is very optimistic people, but when he suffer from this Alzheimer's disease, maybe feel depressed, he may change to very depressed people. So this will change in mood and personality, and the percentage is not very low. About 20 to 30% of the early Alzheimer's patients will experience this change in mood and personality. And for a typical age-related change, developing very specific ways to doing things and becoming irritable when a routine is disrupted. So these 10 early signs and symptoms of Alzheimer's, as you can see from the last few slides, they also related to the typical age-related change. Maybe the major differences between Alzheimer's and getting old is that how often these symptoms happened. Will they really affect their daily life of people? If they do, maybe they have this Alzheimer's disease. If just happened occasionally, for example, a few times in 2 months, and then that's just getting old and forgetting things. That's completely different concepts. And then, as we mentioned, because it's so similar to the age-related change. So when they go to the diagnosis of the Alzheimer's disease, they need the experts to do the diagnosis. However, there is no single diagnostic test that can determine if a person has Alzheimer's disease or not. Usually, the physicians can use a variety of approaches and tools to help make a diagnosis. Although the doctors can almost always determine if a person has a dementia or not, however, it's difficult for them to identify the exact course of dementia. So still, they need a variety of approaches and tools to help them for the diagnosis. Here shows the diagnosis, the tools or methods for the Alzheimer's disease diagnosis. First, the doctor or the physicians will talk to the patient, ask them for the medical histories, and then they will do the physical examination and the diagnostic tests. And also because Alzheimer's is one kind of the brain injury which have neuron damage, so they will affect the function of the brain. So the physicians will also do the neurological exams for the patients, and then they will analyze their mental cognitive status tests, and also they will have some image technique, the brain imaging, including the MRI and CT analysis, the status of the brain for the patient. So with all the helps of these approaches and tools, the physicians may make a decision if the patient have the Alzheimer's disease or not, which type of dementias they are, so they can get a conclusion from those results. So we have finished a brief introduction about the Alzheimer's disease. Next, I would like to talk about the pathology of Alzheimer's disease. So as I mentioned, the Alzheimer's disease is still now unclear to the scientists. That means no one can tell the exact pathological mechanism to develop this disease. However, they have found some hallmarks in the Alzheimer's disease patients. They include inside the brain of the Alzheimer's patients, they have found beta amyloid plaques. And also they found the development of neurofibrillary tangles. And also they find gallosis and neural loss and cerebrovascular amyloidosis, and also inflammation and major synaptic change inside the brain of the Alzheimer's patient. So, so many hallmarks change in the brain of the Alzheimer's patient. We cannot introduce everyone with details, but I will pick up some of the key hallmarks to explain the pathology of Alzheimer's disease. So the first one is a model for beta amyloid-induced neurotoxicity and glial response in Alzheimer's disease. So this photo shows very complicated interaction between the neurons. Here, this is a neuron, and this the pink one is the astrocyte, and this green one is the microglia. So this is three major types, cell types inside our brain. So as you can see, they are not separated by themselves. They are closely interact with each other. So first, as you can see here in this rectangle, here APP, still remember, is the amyloid precursor protein, right? The APP. First, inside the neuron. So inside the neuron, the beta amyloid is generated by this APP cliff weight. So at first, it's the precursor APP. And then they are they are cleavage by some of their enzymes, and then release this circle, dots, which write in the blue dots. So these are the beta amyloid. So this beta amyloid have two directions, as you can see in this figure. First, they can directly damage the mitochondria. This yellow one is a mitochondria. As we know, the mitochondria is very important organelles inside the cells to affect the respiration in our cells to supply the energy for the cells, right? And once this beta amyloid damage the mitochondria, it will cause a change inside the mitochondria, including increase the caspase 3, which is a apoptotic pathway for most of the cells, which means that this beta amyloid can damage the mitochondria, so that cause the apoptosis in the neurons. Also, because the mitochondria is a very important organelle inside the cells to produce energy, right? So once the mitochondria is damaged, and then ATP, which is a current energy form inside the cells, will reduce the ATP. So reduce the energy levels inside the neuron, which can later dysfunction of this dysfunction of this neuron. And also the damage of the mitochondria can increase the ROS. What's RS? RS is a reactive oxygen species, which is harmful to most of the cells. So the beta amyloid can damage mitochondria and increase apoptosis, reduce the energy, and then increase the oxidative stress inside the cells. And this can cause synaptic dysfunction, which means the dysfunction of the neurons. So this is one pathway the beta amyloid affects the mitochondria. And also the beta amyloid can release from the neurons as the monomer, right? Then the monomer, after they release in their extracellular space, they can bind together again to form the beta amyloid oligo. As you can see, the oligo includes 5 monomers to form the beta amyloid oligo. And this beta amyloid oligo, once they can bind to the fibrils so that they can form the beta amyloid plaques. So as we mentioned here, these beta amyloid plaques are the primary pathogenic hallmarks for the Alzheimer's disease. So this beta plaques of beta amyloid can do harms to exhibit the toxicity effect to the neurons. And also the beta amyloid oligomers shown here in this red circle here, they have a lot of receptors within their neurons, the astrocytes and the microglia. So as you can see here, the beta amyloid oligomers can bind to a lot of receptors on neurons, also cause degradation of the neurons and cause synaptic dysfunction. And also this beta amyloid can bind to the receptor LRP1 in the microglia, which is kind of immunocells inside the brain. And then the binding of the LRP1 of this beta amyloid then can activate this microglia and then release a lot of inflammatory cytokines here, including TNF-alpha, IL-1 beta, IL-6, IL-8. Those all are inflammatory cytokines. So this inflammatory cytokines, and then you can see it can affect the astrocytes, right? And then activates the astrocytes, and then further, these astrocytes can release more cytokines here, further perform the damage to the neuron. So all these three types of cells work together. They can react to each other, all linked by the formation of beta amyloid oligomers. So beta amyloid is once a very popular drug target for the development of anti-Alzheimer's disease drugs. They want to remove the beta amyloid, and they want to clear all the beta amyloids inside the brain so that they can block all this damage to the brain. So this is the model for beta amyloid induced neuron toxicity and greater response in Alzheimer's disease. The next model, it's related to another protein, which is called the tau protein. So that's more recent researchers, they found that not only beta amyloid are important in the development of Alzheimer's disease, but also this tau. This protein, if they have this function, they may cause Alzheimer's disease as well. So what's this model about? As you can see, also this different two neurons. This one is the presynaptic neurons. This one is the postsynaptic neurons. They're all neurons. They belong to the neurons. And this is the microglia cells. And the tau protein, as you can see, first present in the presynaptic neurons here. So this tau protein usually proteins bind to the microtubes inside the neurons to maintain the structure of the proteins. So actually they play a very good function. They are needed for the function of the neurons. However, this tau protein can undergo post-translational modification. What's post-translational modification? Translational modification means that the modification happened during the translation from the mRNA to protein synthesis, right? But after the protein synthesis, if they perform the modification again, that's the post-translational modification. The tau proteins can undergo a variety of post-translational modification. Once those post-translational modification goes wrong, will cause aberrant post-translational modification, then they will have the dysfunction or aberrant tau protein, including the truncation of the tau protein, including the hyperphosphorylated tau protein. So those aberrant tau protein, then they don't bind to the microtube anymore. They don't exhibit their normal function. However, they can aggregate together to form the tau oligomers, as you can see here, the tau oligomers. And this tau oligomers can form the PHF and NTF, which are the hallmarks for development of Alzheimer's disease. And also, this later products, the NFT and PHF, can damage the mitochondria, as you can see here, the oligomers, then form the NFT and PHF, and then damage to the mitochondria directly. And also it can release or change the vessel delivery and then cause the abnormal function of the presynaptic neural function. And then in the postsynaptic neurons, those aberrant tau protein, as you can see, they can express directly and then bind to the receptors on the postsynaptic neurons. And then they can activate a lot of signaling pathway, and then they can exhibit the toxicity against the neurons. And also this aberrant tau protein can also bind to the microglia, and then they can introduce more or a lot of inflammatory cytokines, which can further damage the neurons in the brain. So this model shows that the tau protein, especially for the aberrant post-translational modified tau protein also played important role in the pathogenesis of the Alzheimer's disease. So tau protein and also the beta amyloid protein are very important hallmarks in the pathology of Alzheimer's disease. Okay. So we already know about the pathology of the Alzheimer's disease, and then next talk about the drug development for treating the Alzheimer's disease. So how is Alzheimer's disease treated? Actually, medical management can improve the quality of life for individuals living with Alzheimer's, and their caregivers are supported. Actually, the patients with Alzheimer's, especially in the later stage, they don't remember anything. They don't remember the people they love. They sometimes even forget who they am, who themselves are. So that's very suffering disease. They forget everything, and that's a very big burden for their family, because the family member needs to take care of these patients for 24 hours per day, because without their care of their family member, they may die, or they may get lost, just go out their house, and they forgot how to get back. So that's a very suffering disease. So however, there is currently no effective treatment for Alzheimer's disease. That's mainly because still now the scientists lack of a clear understanding about the mechanism, how this Alzheimer's disease is exactly caused. So the treatment addresses several areas, including first, helping people maintain brain health, stop the process of the brain damage, maintain the brain health. And second, managing behavioral symptoms, for example, release or improve the depression and other change of the personality. And last, slowing or delaying symptoms of this disease. So those are the aims for the treatment of Alzheimer's disease. So far, the US FDA has only approved 6 drugs for Alzheimer's disease. So that's a very, very few numbers compared to other diseases. For example, the last time we talking about the cancer therapy, we talking about the metabolic diseases. Those diseases, we have a lot of candidates, a lot of clinical therapies can be chosen for the treatment, right? However, for the Alzheimer's, only a few drugs can be chosen for the therapy. Significantly, these drugs only modulate Alzheimer's symptoms. They can only improve the symptoms. No drugs have been shown to effectively prevent or completely stop the progresses of Alzheimer's disease. So even though only a few therapies or drugs can be chosen, they are not the best one for the treatment of Alzheimer's. Moreover, effects of these drugs gradually dissipate over time, which means that once they take these pills for example, 5 years or 10 years, these drugs may lose their efficacy. So that's very annoying, because this disease will promote or get worse when the age increase, right? However, taking these pills for a long time, and then they will lose their efficacy. So that drugs are not good for the treatment of Alzheimer's. However, no new drugs have been approved by the FDA for Alzheimer's therapy from 2003 and 2019. So during these 16 years, no new drugs has been approved. Not because no company, no labs study for that, but they all failed. However, last year, 2020, there's one drug approved for the FDA for the treatment of Alzheimer's. I will talk about that drug later in the following slides. Although it's approved by the FDA, however, it's quite controversial. Someone thinks it's not a good drug. Someone think maybe it's a good choice to try for this one. I will talk about that later. Just for this slide, remember that although we have a very big market for the patients, we have a huge number of patients in clinic desire for this Alzheimer's disease drug. However, only a few choices. And these choices are not good enough because they cannot stop the progress of the disease, and they will lose their efficacy during the long-term administration. So there's still a big market for the drug development in the treatment of Alzheimer's disease. A lot of companies try to develop new drugs. Once they succeed, they can earn a lot of money. However, most of them failed. I will talk about the reason about that. Okay, first at the very beginning, a lot of the companies or clinical trials targeting the beta amyloid production. As we mentioned, the first model, because the beta amyloid plays a important roles in the development of Alzheimer's. They do harm to the neurons. They can activate the microglia, and then they can activate the extracyte. And so they are the key player in the development of the disease, right? So at the very beginning, a lot of the drug company targets this beta amyloid for drug development. However, few of them have success. They almost all failed. For example, clinical trials for drugs targeting the gamma secretase. So this gamma secretase, it's an enzyme involved in the amyloid precursor protein processing. So this gamma secretase can help to change the APP, the amyloid precursor protein, into the beta amyloid. So based on the pathology, once we block the formation of beta amyloid from the APP, then we can block the development of Alzheimer's, right? So those drugs, including the gamma secretase inhibitors, such as the semaglutide, which is produced by the Lilide, and alvagacetate, which is produced by the Bristol Myers. Those two drugs have been terminated for the clinical trial because they lack in efficacy, and also they cause severe side effects. Why they cause severe side effects? Because this gamma secretase complex clips their physiological substance other than APP, which means that they not only have effects for the APP, but also they have their physiological effects on other enzymes or other proteins, including the notch. So this gamma secretase inhibitor not only block the pathology of the APP processing, but also the normal signaling of notch. So they will affect the normal function of the human being. So they cause severe side effects. And also this beta secretase lack in efficacy. They stop for the production of beta amyloid. However, they can remove the beta amyloid already exists in the brain, right? So sometimes once the patient are in the late stage of the Alzheimer's disease, this kind of drug lack in efficacy. So they fail in the clinical trial. And then adequate efficacy or severe side effects in clinical trials with BACE1 inhibitor. So this BACE1 is also an enzyme which is the major beta secretase. The previous one is the gamma secretase. This is the beta secretase involving in the amyloid precursor protein processing. So this BACE1 enzyme 1 is the key enzyme to processing the APP into the beta amyloid. So they think maybe gamma secretase is not working, then try the beta secretase. For example, based on this target, they developed the ribarbacestate and atabacestate. These two drugs has been reported. Although inhibition of this beta secretase activity is predicted to reduce the beta amyloid production, however, these inhibitors are seen in increased cleavage of amyloid precursor protein by other secretase. So, although they reduce the APP, the beta amyloid formation, however, they will increase the production of pathogenic APP metabolites. So the efficacy is not good. So they also fail in the clinical trial. And then, in addition to this BAC enzyme 1 knockout mice has been developed in the lab. So the scientists think if this enzyme is important to related to the beta amyloid protein formation, then how about we try to develop the gene knockout mice to knock out this BAC enzyme 1 inside the mouse and see what will happen when they developed Alzheimer's. And then these mice exhibit a variety of neurological defects, which means that they have dysfunction in their neuron, indicating that this enzyme actually can mediate many fundamental functions in the brain. So this target is not safe for drug development. Once it's blocked completely, they will cause neurological defects in animals. In addition, conditional BAC enzyme 1 deletion in neurons. This time they use the conditional knockout. The first one, BACE1 knockout, means the full body, the whole body BAC enzyme 1 knockout. And then they found it's toxic. And how about only knock out the BAC enzyme 1 in the neurons? That's conditional BAC enzyme 1 deletion in neurons. And then features enzyme guidance defects, suggesting that this BAC enzyme 1 depression may have additional non-autonomous roles in neurons. So they are very important for neurons functions. So this target is not safe. So this trial, these drugs fail again. And then next move to one successful example. That's our immunotherapeutic approaches targeting beta amyloid. So this medicine is called aducanumab, so which is developed by the Biogen company. So this is a human monoclonal antibody. So what is monoclonal antibody? I think you have learned immunology, so you may know this concept. So antibody can specific response or bind to their specific antigen, right? So this aducanumab can bind directly to the beta amyloid fibrins and also the beta amyloid oligomers. So this fibrins means the beta amyloid plaque, and this beta amyloid oligomers can play important toxic roles to their neurons, right? So these monoclonal antibodies can bind to these risk factors inside the brain. And then the company has announced that higher doses of this aducanumab shows 23% improvement in Alzheimer's patients in one of 2 phase 3 trials. So based on those data, the FDA approved this drug this year, just in June this year, as an accelerated approval program. However, as I mentioned, this drug is quite controversial. For the FDA meeting, usually they will have scientists or experts to vote for the approval or not for the drugs, right? So during the meeting, actually 10 experts or 10 doctors, or including doctors and scientists, don't vote for the drug. They think it's not working. It's not worth for approval. However, the FDA still used the accelerated approval program to approve this drug. Why the experts don't approve, don't vote for this drug? That's because actually this Alzheimer's, this aducanumab, drugs has performed 2 phase 3 trials. Actually, they do 2 separated phase 3 trials. However, one of the trials shows very good positive results. However, another phase 3 trial did not show the same efficacy of the drug, even though in the second trials, not only they cannot find a very positive data, but also some of the patients experience worsened condition after the treatment of this new drug. So most of the experts think one shows positive results, one shows negative results. They should have a third clinical 3 trials to conclude that if this drug is effective, if they are safe or not. However, the FDA passed this requirement. They just think because in the past 16 years, there's no drugs for the treatment of Alzheimer's disease, and the phase 3 clinical trials takes years to complete. So they think they should give a try for this this new drug, so they approve for the drugs. That's very controversial in the US. If you are interested in this news, you can search these drugs online and then see the detailed story about this one, about this new drug. So this is the only new drug which is approved by the FDA in the past 16 years. Okay, next, another candidate for the treatment of Alzheimer's is called BAN2401. It's also a monoclonal antibody targeting large and soluble beta amyloid protofibrins. Now this drug is under phase 2 clinical trials. Now the data shows positive feedbacks. They can remove beta amyloid and slow cognitive decline. So they have effect for improving the mental condition of the Alzheimer's patients. And now the phase 3 clinical trials are currently ongoing. So we don't know it's working or not. If they can pass the phase 3 clinical trial, they can be approved for the market. In these trials, this BAN2401 is being tested in asymptomatic individuals with the beta amyloid plaques in very early stage of the disease onset. So this one's still unknown. Okay, then the next target is not beta amyloid anymore. For another target, it's about this tau protein. So this tau, as I mentioned in the model before, it's also a critical therapeutic target in amyloid AD. It's related to the both the neurons and the microglias in the disease. So one drug targeting to this tau protein is called methylene blue, and its derivatives. They have been tested for its ability to inhibit the tau accumulation. As I mentioned before, the tau protein, if they undergo the aberrant post-translational modification, they can aggregate to each other to form the tau oligomers, right? So this tau accumulation can cause the later toxic to the neurons. So this methylene blue and their derivatives inhibit this tau accumulation but have yet to produce positive effects in clinical trials. So they can block the accumulation, but does not doing very well during the clinical trials. A possible explanation for this may be derived from the effects of methylene blue on increasing the granular tau oligomers, in which may trigger neural death despite concurrent effects in reducing tau fibrils formation. So although they reduce the tau fibrils formation, on the other hand, they increase the granular tau oligomers. So balance for these two effects, the effects of the methylene blue is not very good. So this one failed. Moreover, use the tau kinase inhibitors. This kinase, as you can see in the name, this kinase can perform on the tau protein. So once they are inhibited, so their post-translational modification of tau protein can be reduced. So those tau kinase inhibitors include this GSK3 inhibitor, tideglusib. They try to use this GSK3 inhibitor to attenuate pathological tau hyperphosphorylation. However, this inhibitor shows little or no efficacy in the phase 2 trials, probably maybe due to the clinical role of GSK3 in multifunctional signaling pathway. This GSK3, actually, they have a lot of other functions. So once used the inhibitor to block the whole signaling pathway, it may cause severe side effects. So they failed also in the phase 2 trials. And so many failed examples, only one succeed with very controversial opinions in US. Let me introduce one drug developed in China, which already approved by the Chinese Food and Drug Administration for the Chinese market, which is called GV971, which is developed by this female scientist in Shanghai. Also, this drug just gets US approval for the stateside trial in the US. So this GV971 is oligosaccharide. So it's one kind of carbohydrates with a complex structure, which you can see the structure of this GV971. This compound is isolated from the seaweed, from the sea, seaweed from the sea. So this drug mechanisms is based on the evidence for a link between the gut dysbiosis and information in the brain. So this figure can show the mechanism of the GV971. So a lot of physicians or scientists find that in our guts, there's a lot of microbiota inside the gut. Why? Right? So this gut microbiota can secrete a lot of different things. Some of the things can migrate and entry inside the brain. So if the gut microbiota gets dysfunction, so the balance between the gut and the brain will be destroyed, and it may cause chronic inflammation in the brain, so that cause the brain injury and then develop the Alzheimer's. So this is the key mechanism for the GV971. So as you can see again in this figure, so this is the gut inside the human being. So once the gut the bacteria or other microorganisms get dysfunction, they lose the balance of their different organisms inside the gut. They can secrete some of the amino acids inside the blood. So the amino acids include this PHE, which is the phenylalanine, and ILE is the isoleucine. Some of the amino acids can secrete from the gut and then into the blood, so that they can proliferate or promote Th1 cell proliferation or differentiation. So this activated Th1 cells, which are the immune cells, these cells can migrate and pass through the brain and then activate the microglia and then promote the beta amyloid plaques deposition and damage the neuron cells through the intermediary cytokines. So this is how the gut related to the brain health. And then this GV971 can maintain the treating with the GV971 can restore the normal gut microbiota so that they can reduce the level of intermediary cells and reduce the beta amyloid plaques in the brain, and then ameliorates the cognitive impairments of Alzheimer's model mice. So this one, unlike previous approaches of targeting at the generation or the existing level of Alzheimer's pathologic markers, not targeting to the beta amyloid or tau protein directly. So this GV971's efficacy may be attributed to the fact that it acts upstream at the origin of the pathogenesis, and thus they are capable of slowing Alzheimer's progression in patients with early and mild stage Alzheimer's disease. So this drug has already been approved by the Chinese Food and Drug Administration and now is on the market. And also later they may start the clinical trial in US, maybe later it can be used worldwide to treat the Alzheimer's patients. And last, I would like to conclude some of the lessons from the clinic. Why is so high failure rate for the development of anti-Alzheimer's disease? I think that's because most of the Alzheimer's disease models comprise transgenic mutations associated with familial early onset Alzheimer's disease, which means that we developed a lot of the transgenic mice with the RIX genes or the deterministic genes to develop the mice model. This may not be ideal for the sporadic Alzheimer's disease research because in clinic, more than 95% of Alzheimer's cases are sporadic. So it is necessary, although it's very difficult, to develop non-familial Alzheimer's disease models, animal models for the development of anti-Alzheimer's disease. That will be very difficult. That's because this kind of disease related to age, right? So you may raise the mice for more than 2 years to develop the Alzheimer's disease. And even so, maybe most of the mice cannot develop this disease. So using a non-transgenic mice model, develop this model would be a challenge for most of the labs. And now recent studies have indicated that adopt research monkeys can effectively model Alzheimer's disease-related neurodegeneration in primate brain. And this may represent a more appropriate model for Alzheimer's disease treatment. However, as we know, using the research monkeys could be very, very expensive. Not every lab can support that kind of research. So to figure out this problem, maybe the scientists should work harder to figure out a better way for the future study, okay? So that's all for today's class. As usual, if you have any questions, welcome to send me any emails for questions. Thanks again for your attention for today's class. So see you tomorrow night. Thank you. Okay, bye-bye.
finish, guys?